It is 5:05 p.m. I want to welcome everybody here on the Zoom and everybody following us on Facebook Live to the 18th edition of consecutive of AB1400 CalCare office hours, happening on a big weekend in the Medicare for All movement, in which there were nationwide marches advancing the cause of Medicare for All, and including here in California, those had a considerable amount of focus on what we're going to be talking about today, which is AB 1400. So just so everybody knows, whether they're new or old or new to this activity, we're every Sunday from 5 to 7 p.m. And our purpose is to keep an ongoing conversation about a particular bill that was introduced into the California legislature in February, AB 1400, which is the Guaranteed Healthcare for All Act, and would create a universal single-payer healthcare system in California. The system would be called CalCare. So you hear us call this CalCare. This activity is a joint production of Healthcare for All Los Angeles and PNHP SoCal. And I will say that in particular, the people involved in Healthcare for All Los Angeles have been working very hard, in particular in the marches and the march in Los Angeles. And so we may have some folks who are taking a breather because they're recovering from incredible outpouring of effort, or people who are new who heard about this. Wherever we are is where we are. But what I want to do is start with a brief introduction to this bill, because we always want people to kind of just know a little bit about what is this thing? What would it mean to do a single payer bill in California? What does this bill look like? And then we'll just launch into questions that people have, whether they're here in the Zoom or on Facebook. So let me, I'm going to share my screen, and let's see how this goes. How's that? Can you see what I'm sharing? Pretty good. Yeah. So we owe an ongoing debt of gratitude to the folks at the California Nurses Association, CNA, because they organized internally and then with members of the legislature to introduce this bill, AB 1400, into the California legislature in February. And it's what's called a 2-year bill. It'll be up in front of the Assembly's Health Committee in January, but we are taking all this time to educate and organize about it. And this is part of the spirit of office hours. And so what is this bill about? I mean, the bill is, it's like, well, it depends how it gets paginated. It's something like 65 odd pages of stuff. But there's some core principles that I think really would give people a good idea of what is it about. So first of all, it's a single payer bill, and that implies, and it would provide universal coverage for everybody in California. So universal health coverage. And by universal, we mean like everybody in, nobody out. And that particularly, when you think about people who've been left out of our systems, for example, people with different immigration papers, or people who just they fall through the cracks of the existing, programs or non-programs. This just says, nope, everybody's in, nobody's out. And it would be a single public program, or at least the insurance function of it would be a single publicly funded program that in a state like California would gather all the existing public funding of healthcare and with a little bit of new taxation, which would be done progressively, would cover everybody. And at the same time, that eliminates a whole bunch of other spending on premiums and businesses spending on directly on buying their employees' health insurance and all of the out-of-pocket costs that people pay. So it would switch to a single payer, single public program in terms of insurance. People's healthcare could still happen in private settings or public settings. That's separate, but the payment system would be single, and that would be everybody. And it would have fully comprehensive benefits. It would cover everything. So a lot of, there's a lot of problems with coverage right now where people have something called health insurance, but it doesn't always cover things that matter to people, like their hearing or their teeth or their vision. That's, for example, in Medicare. And so there's, but this, the bill, and it spells out a kind of a list of covered things, will cover all that stuff. And so that's important. And that would include things like long-term care, which is an important sort of messed up system here in California and other places. The system would also give people freedom to choose their care provider, because under CalCare, you wouldn't see narrow networks. So right now, there's so many narrow networks. So again, you might have something called health insurance, and that may define a very narrow or limited group of people or hospitals, whatever, that people could go see to get healthcare. But and that's very characteristic of our current system, but wouldn't be a characteristic of a single payer system, which would have essentially almost everybody would be on the in-network side of this. And there's some pretty good reasons why, if you look at the bill carefully, that you can see that that would be the case. And that would give people way more freedom to choose their healthcare providers or their hospitals. And it's interesting because freedom, this is, we're still July, 4th of July, liberty, freedom. And our healthcare system currently right now is not defined by a lot of freedom. But we think that a system like this would give people way more just ability to choose the thing that matters to them. And that is where they go and get their care. And that's different for different people, what they want. So freedom of choice. And then also freedom from the need to make payments at the moment when you need care, because the bill would eliminate co-payments, deductibles, lifetime limits, would also eliminate premiums, so that you just kind of go to the office and you show them a card and you get the care you need. And it's that simple. And one of the things that I think there's been some pretty important press lately, and maybe we'll hit on it, but just how much medical debt is out there, right? And for every bit, and there's a ton of medical debt, and it's a terrible problem, big cause of bankruptcy, big cause of collections. But for every person who's gone into debt out there, there's a whole bunch of other people who denied themselves care that they needed because of the fear of going into debt, or the fear of killing their credit, or losing their home, or losing their car, or having to make terrible choices like that. And so, this is a really big feature it's a big negative feature of healthcare in the United States, and certainly in California, and a really sort of foreign concept to people in other countries when they look at a system where somehow, like, going to get healthcare that you need ends up sort of killing you financially. And then you are sort of forced to internalize that pressure in making decisions about whether you need healthcare or not. So those are things we'd like to get passed in California. This is one of the reasons that this bill is very important. So the bill also anticipates what we call a just transition. That is that when you change, healthcare is a big part of the economy. It's in fact too big. Something like 18+% of the economy, up or more. And there's a lot of people employed in the things like the insurance industry and in billing and the nature of a lot of people's jobs might change if we had a more rational healthcare system. And the folks behind the bill, the California Nurse Association union, are very aware of like workers, and they are workers, and people work hard doing things under a current system. And if we transition to a better system, that we can't just sort of like leave a bunch of people behind, and that, you know, that means a lot of different things, like retraining people or providing really extended unemployment benefits, replacing income. So it's a set of things, and that's in the bill. And finally, that CalCare is, it's based on patients getting care because it's what they need, and that the people who provide care shouldn't have tons of kind of funny incentives, like incentives to avoid providing necessary care, or sort of systems that kind of say that they're going to be about some kind of value, but in the end are about saving the insurance company or somebody money, and that the care decisions are based primarily on just what people need. And, you know, most people don't want a bunch of care that they don't need. So there's a little bit of built-in, you know, limitations on that. And so we can talk more about that. So that's kind of in a nutshell what AB 1400 is. And with that, I haven't been following the chat, but I just want to say, but now I'm going to peek at it, but I want us to launch into our, into discussion, and just say that great sources of stuff to talk about might be, well, things here in the chat, questions that people have out in Facebook, but also if people out there were involved in the marches, anywhere like in California or beyond, and they heard things or ideas or questions, or, you know, had a back and forth with somebody in the, you know, and that brought up questions, well, let's bring those out. So let me start by seeing some of the things that are in the chat, and certainly invite comment too from people here in Zoom, or well, people here in Zoom. People continue to ask me, this Paul Newman writes, how are we going to pay for it? And he says, okay, so Paul Newman says, people have, who are a very dedicated activist, by the way, have continually asked me, how are we going to pay for it? And I told them AB 1400 bill is a policy bill, which is right. That being said, it's true that the California legislature will be forming the policy and how it will be paid for. Would you say that it has a more politically strategic side to see which legislators will do their job? This could really benefit. Would you say it has a, I'm not sure I'm totally grasping that question. Paul, do you want to just ask your question?
Sure. What I'm basically saying is the structure of this bill is a policy bill, which we're going to leave up to our legislatures. If the legislatures, it basically forces them to work on it. You know, I would think, or, you know, I would rather say they should be grateful and glad to work on it. It could be, have a political, strategically would be political, it'd be politically good for them. However, I'm wondering that when they put the bill together and the policy, that this was also giving the legislature a chance to prove themselves to the people, you know, and in other words, you know, oh, we'll give it to a private insurance company to handle it all. You know, I mean, they could come up with things like that, but the guidelines in the bill itself won't allow that, which is great. You know, so basically my point is it's forcing them to do their job. And that's my question too. It has a strategic purpose to force them to do their job.
Well, I got it. And so I have a couple of thoughts, but I also saw that Dr. Bill Honigman here in the Zoom had some thoughts and answers for the chat. Did you want to articulate any of those for the right now, or you want me to take us, Dr. Bill? I think you were kind of responding to the how are we going to pay for it part. But
yeah, I think Paul's bringing up a more like a process type question, like is the process to get the how to pay for it in there, as opposed to asking what the policy would be for paying for it, question. And so it's funny because that question is usually brought up by the opposition forces that, I can remember over a decade ago, like when excuse me, when Jerry Brown was running for governor right at the beginning of it's like his third term in office, and somebody confronted him at a Democratic Party function and asked him if when he got in Sacramento would he sign a single payer bill, and he said, yeah, as soon as we figure out how we're going to pay for it. So it's this one of these very kind of, sounds almost simple-minded questions, but it has layer upon layer of innuendo built into it. And I think it's thrown at, those of us who are trying to make this thing happen as a way to make us stumble, as a roadblock, as a major roadblock, where, our response really should be, well, we're going to pay for it, the way we already pay for healthcare. We're just going to pay a whole lot less than we already pay, because that's the problem right now is we're paying too much and for it not getting enough. So that's got to be our response. And if they need details, then you're right. The strategy is give it to the legislator to put in whatever details need to be put in to make it work. There are such systems in place already, obviously, like for the VA, on the federal side, VA and Medicare, for Medi-Cal, some of that is federally funded, some of it's state funded, but it's coming from the taxes that we all pay and go into these government funds, and then they're used to pay hospitals and doctors and clinics that then provide the care and then bill the state or federal government for it. So the systems already exist. They just need to be expanded to cover everybody instead of just these select portions of the population, like the elderly or people below a certain income level. And that's what I think, can answer with. We just pay for it the way we're already paying for it. We just expand it to include everybody and let them figure out the details, on how it's done, as you say, as the strategy.
Yeah. So one, Abs couldn't agree more. And one of the facts is that in the United States, and California is no exception to this, we spend more on healthcare than every industrialized country as a percentage of our GDP, but we get worse results. So the money is there. There's no question the money is there, and the practical political questions are about how do we redirect money that is there to essentially non-wasteful, fraudulent, abusive processes, but to healthcare. And I agree with, and that's what the legislature needs to do, right? It's essentially like a money redirecting project. And at one level, there's more to it than that, but that's a big part of it, doing that. Well, so first, existing monies have to be gathered. And so what are those existing monies? So there's all this money like the federal government spends on healthcare in California. And so that's money that comes from taxpayers, goes to the federal government. And then, and I see that. Yeah, that Nancy has a question. Come back. Well, Nancy, we'll get to you, I promise. The money comes from the taxpayers go to the federal government, and the federal government spends in big amounts in the state of California. And the federal monies would be captured through a process of waiver applications and waivers of federal law that essentially allow a state, especially the Affordable Care Act, to redirect money to a program run by the state. And then there'll also be some tax program, but that tax program will net out to less money than people spend in other ways. And that's how they'll do the redirecting. But then I think part of the question is, well, where in the laws will these decisions get made? And so the current bill doesn't yet have its tax program added to it, but we've gotten a lot of kind of signals from the folks in the legislature who are working on the bill that they will provide those structures. We've seen ideas for that in past bills. There are many proposals. So that's part of the answer there too. But then I also think that, Paul, one part of your question was sort of like, who's going to do the work of sort of making the big insurance company, right? Because we're basically like going to make a giant single insurance company for California. And you're right that the bill says that if you decide, and I think there's a good policy basis for this, if you decide to contract out your insurance company to a bunch of other insurance companies, which is sort of what we do a lot with things like Medicare Advantage, what Medi-Cal, which is Medicaid in California, does to a bunch of private insurance companies, you end up losing, you lose a bunch of the benefits of single payer programs. So it says instead that there's going to be a board that's defined by the bill that is going to build a big insurance company for the state of California. And that board is going to, that's going to be a public activity. And that board is going to have 9 people on it. And then and so in part, Paul, I think you're right that the legislature has some responsibility for the architecture, but the building has to have the execution is legislatively defined as a board. And that board has 9 people on it as the bill is written right now. And I think then that segues into a question asked by Chris Shimizu. And then when I finish this, we go to Nancy's question or comment or thoughts. What Chris asked, and I'll just read her question aloud, is have any particular people been floated as who would be on the board? It's only 9 people, right? Would those 9 people all need to review every single case in which a California wants treatment that might not be covered? Won't that be too much work for so few people? So I think it's right to say, so this board of 9 people that would be created by the bill, called the CalCare board, or the trust fund board. I think that they would be overseeing a very large activity. And so I don't think that they would be in the weeds of individual cases. And so I think it's more to say they would be setting the policy that would then create additional structures to deal with individual problems of coverage. And not be the decision makers. I think that would be, those would be delegated functions. So that what will this board do? I think it'll kind of stuff Paul was talking about, which is build a big master system for the state. And that's got to employ a lot of people doing a lot of things. And then more like granular questions, that's part of their thing, is to build structures, answer more granular questions. So I think that maybe hits some of those things. I know my internet is so stable, I can tell. But you were waving your hand in your car. Did you have a question or a thought?
I just want to make a comment that I learned from you and Dr. Bill all the time. But I think it frustrates me that advocates of single payer seem to be threatened and defensive when that question is asked. And I really wish that people would simply at least have an upfront response that it will pay for itself. And that's been proven throughout the world. And we should be more comfortable in having that response ready. The details are fascinating, and I thank you so much for informing me, but I wish people were more comfortable with that.
Well, wait, so let me play this out. And I hear you, and I'm a bystander at the March for Medicare for All, and Nancy, you're walking by me, and I say, Nancy, or Dr. Nancy, if I see you're wearing your Dr. Nancy, coat, Nancy, it sounds like a good idea. How are we going to pay for it? What are you going to say?
It's going to pay for itself. That's been shown in every developed nation.
That it costs less and not more for the whole system.
Correct.
Right. In that sense, it's like, instead of eating at a bad expensive restaurant, we're going to go to a cheaper, better restaurant. And so the money was already there. Oh. Right? No, or is that already too much answer?
No, it's the administration. I think we need an elevator response, and we should be ready for it.
Yeah, but
it always gets uncomfortable.
No, that's fine. But the elevator response you just gave somebody might come back with more questions, right? No, or not.
Then I'll try to share some of what I've learned from you guys. But to begin with, I think that there should be a quick and confident response. That's a stupid question. Not to say that, but we should have that attitude.
Yeah, the first answer should always be that it's a cheaper, not more expensive way to do healthcare to cover, and still covers everybody. And if you want to get into the weeds of how that is, let's talk. But although that's one reason why office hours is 2 hours and not 1 hour. We considered 1 hour model at the beginning, but we did want to be able to give people a little bit of like what is under the hood too of this car. But that doesn't mean we should lose sight of the fact that it should look like it's a car. Yeah, Dr. Bill, I see your hand up.
And Nancy is absolutely right on in that, in saying that it pays for itself, because people have a very, very mistaken, misguided belief that it costs more, not less. And they can't conceive of the fact that we could cover everybody in the state. Doesn't matter what your status is, your economic, your income, your migration stat, doesn't matter what your status is. We could cover everyone in the state with so many more services than we get now. I mean, it would make the most Cadillac plan out there look like, like a ridiculous, I mean, it's so much more comprehensive. It includes the dental, vision, and hearing that we're struggling just to get into this infrastructure bill for the federal bill, right? It includes long-term care. It includes all mental health services, which, we have mental health workers are fighting with Kaiser trying to get enough time to see their patients. This includes all of that. So you would have as many health, mental health provider visits as you need, right? All of that is included. People cannot conceive that it would actually cost less than what we're spending now for healthcare. And it does. It costs less, not more. And that's not just us saying it. That's economists saying it. That's social scientists, including public health specialists, saying that it will cost less. In fact, it costs so much less that we'll actually save, about $40 billion per year for the state. I mean, $1 billion for every million of the population is the general guide of how much it saves. So, I mean, this is well-established social science fact, that it costs less. People don't know that. So Nancy's right. It pays for itself and actually then even goes a step further and saves money. And in terms of the process, we have all the systems in place already. It just needs to be expanded. I mean, if you think about what it took to get Medicare for seniors, nationwide, all it took was, they were issued a card. Seniors were issued a physical, paper card, and it took about a year's worth to get everybody enrolled. And they had some rudimentary system of some kind that billing could be done back then in the late 1960s, before we had an abundance of computerized systems to be able to process all this. Now we have computerized systems that process all this. And that is how billing is done for both Medicare and Medicaid. It's done by computerized systems that process it. That it would not be hard at all on a national level, let alone on a state level, to roll out all of those processes. So that's the how to, is to expand it. And then in terms of the funding, okay, so instead of paying through your employer, then maybe it still is a payroll deduction of some kind if you on somebody's payroll. If you're not, then maybe it's an individual payment that you make into the system, or a business will make into a business payment into the system, and that will help support it. But it's still less than what all of these entities are paying now into the system. So that's the how to in terms of the process. But Nancy's right. I think to overcome that notion that it can't be done, that it's that it's going to cost too much. She's absolutely right. It not only pays for itself, it goes the next step and saves money in the process.
Maybe somebody else could come up with, there's certain points in your life where you realize you've been doing something really, really complicated, and then there's like a simple thing out there that does it, like sometimes like kitchen devices or something like that, like you've been, I mean, this weekend I made pasta, and I do that every so often, and I like to do that. It's pretty fun, and something I do with my kids, and it's like involved. We have to get flour and all this stuff, and it's really and a machine, and it takes hours and hours, and it's pretty good, but it like as if what I had been doing that all this time, and then I discovered that right next door to me there was just like a grocery store selling really good pasta. Now I'm not arguing against home cooked foods, but just the complexity of doing it was like sort of a fun activity. But if that was like, we're doing that every day, this incredibly complicated stuff. And it's like right next door, say in Canada, for example, they just were like, oh no, we just like go to the grocery store and buy the pasta and it's done. And then we do other stuff. and it's cheaper than your thing, because that takes a whole bunch of effort, and it's a mess, and it's really complicated. And I know pasta has been one of our ongoing thematics in office hours because of the great spaghetti. The complexity of our system is also spaghetti-like. But so anyhow, let me ask if for people who are out about in the and I was out of town for doing this family trip, so I was sort of wasn't where one of the marches was. I mean, sort of too rural a place. But was there anybody who was involved in any of the marches hear any things or questions that came out of all that? Anything? No? Thoughts? Paul, did you hear any?
Well, I heard we would stop and have different political candidates who were running on the single payer platform, and it was great. Most of them were great, and local people that are running. But they also had personalities like Jimmy Dore and also a candidate who's running, Maria Estrada. And their points of view seemed to be more divisive to me because they were attacking some of the candidates who, on the higher level of government who support single payer, like the Squad and so forth. And to me, I felt that's a bad strategy because, you know, people are giving this exposure. And granted, I'm all for different points of view, but you know, we have all one goal, and that is to have single payer, and we don't want to divide. It made me feel very uncomfortable. That was the only thing that I didn't like. And, you know, there were some people that had extreme points of view. I think everybody's doing a good job, and most of the ones running, most of the candidates running, like Shervin and who else? God, there's so many of them now. Who support single payer and are on that platform weren't divisive at all. And I just didn't like the attacks. I mean, it would have been more productive. I mean, it gives people, it divides people, and I didn't like that. That's a bad strategy. So that's the thing I took away. Other than that, though, a lot of people spoke, including Baba Akili from Black Lives Matter. He gave the strongest speech that just got everybody's spirits up, you know, and so that was a really good, that one was really good. But we probably are going to assemble a little video of highlights of that event, and we'll be putting on Healthcare for All California, excuse me. Pardon me. So that was my takeaway.
Well, so, and maybe then part of the tension that you were seeing there, or the strife, or I mean, you said it as disunity, but is about different views on a question. And the question would be, if this is such a good and clear idea, why hasn't it happened already? Why hasn't it happened already? And you know, so there may be various answers to that, and that may then lead people to different political strategies for what they think needs to happen. I would say that one of the one feature, and this may be true of all the folks who spoke, is that they feel a sense of urgency related to this, because especially like people who are very directly involved in healthcare, or people who are very affected directly, which is many, many people, by the healthcare system, like they don't feel like they can wait 50 years or 40 years or 30 years for political changes that would lead to a better system. They feel like it's urgent because in fact, there's like a calculatable loss of life associated with our current system. And, you know, like even worse during the pandemic. And so that sense of urgency, sometimes, again, then people take some different views of what the meaning of that urgency is. So one view of it is, well, there are bills in front of the legislature right now, or a bill in front of the legislature in California, AB1400, and there's a bill like it in front of the United States Congress to do a national program, House Resolution 1976, and we should pass those. And if we're going to pass those, it requires the people who are actually in office right now to do that. And so that view of that urgency is you got to work with the people who are in office right now. And that if your goal is passing something quickly, then you have to go to war with the people who are out there. And because there are certainly some people who are completely dead set against this politically. So then there may be other people with other view, which is that actually there's not enough of people out there right now to pass this. And that may include people in the Democratic Party who have some issue that will say they're for it and not be for it, or that they won't push hard enough or something like that. So even that urgency may get interpreted differently. Like I think, so I guess one thing is to be, even when I think people disagree within the movement of people who want this, that you do at least, like hear them out and try to understand where they're coming from, and that it may not be some ulterior agenda. It might just be a different analysis of what the path is, basically. So, but Dr. Bill, I see your hand up.
Well, thanks. And I wanted to chime in on that. And Paul, I think I totally relate to your sense of discomfort with that kind of, attempt by some people at least to really pressure our friends, people who we consider to be really friends in the movement, or even champions who are in the legislature, whether it's federal or state. And some people may say, take issue with the author of AB 1400, Ashkara, for putting the bill, on the shelf for a year because he felt he didn't have enough support in the committees, to put it through as a one-year bill. When, very, very rightly, people are pointing out people are dying in the meantime, but if it wasn't going to get through the committees, then he's right to, to hold it and build up more support in the meantime, because it would have just died. It would have just plain died in committee. But I wanted to, if I could share, Ron, if you're okay with this, where'd Ron go? Oh, there he is.
No,
if you're,
I'm here. Yeah.
If you're okay with me sharing just some kind of visuals for this that I've been using in kind of PowerPoint talks. This is a talk I gave a couple of weeks ago for Anna Eshu's district up in Northern California. And what I did was kind of use these stats with these two tools that you can see here. That's Congressional District 18. You can see the Harvard University Daily Tracker tells you how many people have died in the United States in general due to COVID. We're talking about the fierce urgency of now, right? The fierce urgency of COVID. And like you said, people aren't willing to sit back and be complacent when there's all this unnecessary death going on, and it is unnecessary. So in California, that's 63,000 people, was as of 2 weeks ago, 63,716 deaths due to COVID. In her district, Anna Eshu, who's very closely tied with Nancy Pelosi, right? They are political buddies, and physically as well, or geographically, her district's right next to Nancy's. 777 COVID deaths as of 2 weeks ago in her district. When you look at the Lancet Commission study published in February, about 40% of those would have been saved with a single-payer Medicare for all system. So, why is that? For a lot of reasons, especially because resources are allocated by public needs, right? Remember Ron's 7 principles of AB 1400? The resources needed are decided by public needs not commercial needs. And that means people who need healthcare will get them. I remember, Ron, when we first went into isolation, you have a skilled nursing facility right near where you live there in LA, right? And I remember you saying ambulances were just coming to the door like crazy, you know, to take people from the skilled nursing facility to an acute care hospital. We were not getting resources to nursing homes and skilled nursing facilities the way we needed resources to get there. And that caused a lot of our people in skilled nursing to get sick with COVID right away. Well, guess what? We still aren't getting those needed resources for universal testing, for contact tracing, and to treat everybody's pre-existing and what they call comorbid conditions like diabetes and high blood pressure and heart conditions that put us at risk for COVID. So none of that, you know, that's why the United States is such a colossal failure. Even right now with these vaccines, we don't have a universal system. People can't go and talk with their doctor about getting vaccinated like they can in universal healthcare countries. That's the best source for someone who's vaccine hesitant to talk to, is to talk with a doctor. Now, when insurance companies are telling you you can't see your doctor more than twice or 3 times or 4 times a year, and in Japan, they're seeing their doctors 13 times a year compared to our 4 times a year. Who do you think is going to get more vaccinated and more protected against COVID? You know, so it is just that astounding. And if you look at this chart, which our friend Henry Broska drew up, he just charted simply life expectancy in all these advanced countries in the world compared to us, good old US of A, USA, right? Look how we've fallen off the curve of life expectancy compared to what we spend on healthcare. It's just astounding how poorly we're doing compared to the other advanced countries in the world. And you see all these countries, yeah, they have a little decline, a little bit of a decline for COVID. Look at our drop for COVID. Whoop, okay? And if you happen to be a Black male, look at that drop for COVID in life expectancy. It is that bad. So this is what we're talking about. This is our famous spaghetti, you know, diagram. This is the waste in how we pay for healthcare. You know, this is a claim submitted in healthcare. This is the claim paid. It goes through all of these, you know, hoops and barriers. In Canada, it's just this simple, this standardized, this accountable. Here, this is completely corrupt behind closed doors. This is not just waste, bureaucratic waste. It's also fraud and abuse. And that's, they're absolutely right. We should not be complacent, but you have to be strategic, I think, in your approach, you know, and realize who your friends and your foes are, who are actually blocking this moving forward, whether it's in Washington, D.C. or in Sacramento. You know, Ash Kalra is not your foe, right? So that seems pretty apparent. You know, and AOC is not your foe in Congress. So for them to go after AOC and try and apply pressure to her, that seems like a very big mistake at this point. You know, so yeah, I agree with you. And those are a few reasons why.
No, thank you for that. And I saw that Carol Fodera, a frequent participant, fantastic activist, been at marches yesterday and had some things that you saw or wanted to share, observations. Carol.
Sure. We had our table and we talked to people at the table. And then for the march, I was one of the last people at the march because I was watching on the sidewalk who was interested, who actually stopped to watch us and who was filming us with their phones. And then I would go up to those people and talk to them. And some people were from out of state because there's a lot of tourists. So I just wanted to make sure they knew that there's federal legislation for Medicare for all. And then some people live here. And what I found was that the younger people were very on board with this. And, you know, I look at, you know, I'm 62 and I look at how, I mean, I just think it's much harder to be younger now, and rent is so high. Health insurance is so high. Food has gotten higher in the last couple months. Everything's so much more expensive. College, you know, so I think younger people are forced to get it because they're living it. And I talked to one guy who I thought he was interested, and we established that we were the same age, and he was like, well, I'm not worried about it because I'm going to get Medicare. I'm going to retire soon and get Medicare. And I said, well, you know, I said, this would cover eyes, ears, and long-term care, which Medicare does not cover. But that really didn't faze him much. And he said, well, you know, my health insurance has been really good. And I said, well, you know, have you been sick? I said, you know, if you're not sick, if, you know, sometimes it's not, you know, it's doable. But if you get sick, things can go really bad, and you can go into financial bankruptcy. And he was really just thinking about himself and his wife. He wasn't, you know, we have to remember that we are outliers. You know, a lot of us advocates and activists, we're outliers. We think about all people. And I don't want to be too preachy or judgmental, but there's some people who just don't. It's just not where they're at. And so we have to get them to think of how it would affect them. And so one thing I always tell people is, well, what about your children? You know, what about your grandchildren? You know, to try to get, if they're middle class or upper class and they're doing pretty good, how's this going to affect the younger generations? Because they're not like us. A lot of people are not like us. They're not thinking about people they don't know. They're just thinking about themselves and their family. So that's what I found. I found most people were really receptive, and you know, I thought we did a lot of good work yesterday, because I think this is such a huge campaign. And I hope with this one fellow that I talked to who was my age, that I at least got him thinking a little bit more than he's ever thought before. So maybe if he sees an article or talks to someone else about this, he'll be a little more receptive to thinking what this would mean for people outside of his social sphere. So.
Yeah, that's great. And I mean, thank you for that. And you know, when Nancy, who was, I think she's been traveling and it's been on and off, but had said sort of like, you know, we had to have some answers for people. And I think one good thing about single payer or Medicare for all or AB 1400 is there is an answer for the altruist and there's an answer for what's in it for me. And they're both there. And yeah, you might want to talk to the other folks about the other thing, but that's what you have to ask people questions where they are, right? Like not, so absolutely. Erica Ferrison, who's been the one of the chairs of Healthcare for All, had an incredibly busy single payer weekend with the march. But welcome again. And what, I don't know, what did you see? What did you find?
Well, I'm coming in the middle of this. First of all, Carol, I cannot believe you're 62, and I'm wondering if you're seeing Dr. Ron for a little Botoxy talks, because you look so good. Okay, we won't tell. You look so beautiful. I just, wow. Okay. And also, Carol, I was doing other things at the march, so I wasn't aware that you were doing that and staying behind, and just want to thank you so much for that, because that's so important that you did that. And just, I know so many other things that you did. So thank you. And that was so important. When I hear Carol telling that story, I all of a sudden think about, this is an analogy, so it's not perfect, but I think about, and I look at the two doctors on here, there have been some doctors and nurses coming forward about people who objected to the COVID vaccine, and then they're in the hospital and they're about to be ventilated, and their last words, that they say, I didn't think it was real. I didn't think it would happen to me. And then reality intrudes, right? And, so many, like one doctor wrote a story and said to the family, if you really want to honor this person, get the vaccine. Because, right before they're ventilated, some of these doctors and nurses are reporting, I think this doctor was from Alabama. They're like, okay, I'll get the vaccine. And they're like, you don't understand. It's too late for that. And so when I hear this, so the analogy that I'm making is I feel like these stories that Carol is saying, these people like, well, my insurance is good. Well, it's good now until you really get sick, and then it's too late. And then you're losing your house and you're losing everything. And, yeah. And I think, Carol, you have a point. Like for many, unless you've been really sick, you don't really get how bad it can get, even for that gentleman. And I hope that's not the case. But, we've heard so many stories. One spouse passes away and was okay, but then the other spouse that's left is in, almost poverty by the time their time comes. There were so many stories shared at this march. One of them was this man named Dan, who I had never met before, and his mother had recently passed away. And he was able to, I guess, put his life on hold and take care of his mom in her final year or years. Very difficult. But what she really needed to be in was a nursing home. And I don't remember the figure of what it cost a month to be in this nursing home, but I do remember him saying it was a $20,000 upfee payment, right? Upfront payment, which he couldn't do. And he said that they had the paperwork ready to sign her house over to the nursing home. So you're seeing this. I know that, these like Medicaid, like people think like, oh, I'm on Medicaid, I'm okay. But if there are any assets, if you look deeper into that, like people, lose their houses. So this is, right, you have the grandparents that worked and saved and bought the house to pass on to the children. That's not happening now because of our healthcare system. Whether it's Medicaid or whether it's the nursing homes, they're taking people's homes. When this gentleman spoke, Dan, about his mom, and he was in grief, he was still in grief over her passing. And yet he was still in the gratitude that he could take care of her. And he was in so much pain. But what about the people who can't take care of their mothers or their fathers? And this is why he's fighting for Medicare for all and why we're here for AB 1400. But I had a flashback of my great aunt who was in a nursing home, who I visited when I was 12. And I remembered, oh, my mom sold her house to pay for the nursing home. So, people who think that they're fine because so far they've been okay with their insurance, I don't know, kind of wake up. but really amazing speeches. I walked into the middle of this. I'm not sure, you know, what you could hear that would be relevant, but Daniel Lee spoke. He's a city council member in Culver City, and he shared a story how he's had ongoing medical issues. And he shared about how he had to go to the hospital and all these medicines and all of these doctors and specialists who treated him. And because he was an elected official, the bill ended up being $500. He said, but he used to not be an elected official. He said this bill would have easily been $50,000 or $60,000. So you have here, I heard Dr. Bill talking earlier about Nancy Pelosi. You know, not only do these elected officials, which there are some good ones, shout out Ash Kara, and I heard some other shout outs, but I'm just talking in general, you know, they're not feeling the pain of the American people. Their healthcare is taken care of. Also, many of them are so wealthy. I mean, it's just kind of, you know, then there's that aspect, right? But so really incredible stories shared. I'm loving the outreach that Carol and others did. And also I will point out, boy, we had a wild array of speakers, okay? I mean, from all over the political spectrum. And all I can say is, but you know, as wild as an array and as many areas where there may be disagreement, where everyone agreed was Medicare for all and CalCare now. So it does show that this is not a left issue or a right issue. This is a right and wrong issue. It's not a Democratic or a Republican. You will find, you know, all over the spectrum. And the one thing where we are coming together as a people is Medicare for all and CalCare now. And so I think that was, you know, a really beautiful thing also that was highlighted in this march. But and CalCare office hours, you guys, Dr. Ron and all of you holding it down every Sunday. This is incredible what you guys are doing. And I want it to be bigger and bigger and everybody to see it. So anyway, much love to you guys. Thank you. Thank you.
Oh, well, thank you. And yes, this is our 18th in a row, and there are a lot of different people who you know, give so much. You're one of them, and there's just different ways. And you're right that that includes a movement with different some different views, but you have when you listen, you hear things that touch you and that make you think. And, you know, when Carol listens to a guy who says, I have Medicare, I have Medicare coming, I'm going to be okay. And then she thinks about like, well, I just want some other people to be okay too, you know, and then what is behind, or, you know, unpack all that, right? Like what is in this bill for the person who is 3 years away from Medicare? Well, what if they lost their insurance between now and 3 years from when they go on to Medicare? And so they wouldn't. Or what are things that Medicare is missing that this bill would fix? And it's missing things. And, you know, there are people trying to fix some stuff like this about Medicare, but this is one of the fixes, which is, and Dr. Bill hit all of this, the dental care, vision, and a hearing, like, you know, important things that people on Medicare need that are missing that this bill would cover. But then you also bring up the issue of long-term care. And so how would a bill like AB 1400 address long-term care? Well, the answer is that it would pay for it. And we to date have said we have a kind of a funny hybrid system where it's sort of like, if you can somehow pay for it yourself by, like, you're either really wealthy or you have a bunch of assets can sell off, and accumulation of assets has become not an easy, as never was that easy, and it's reserved to a small group of people more and more, right? So that's where if that's the plan, that's like a plan for 1% of people, right? Who can or fewer, who can accumulate assets. So then there's also this other plan, which is that Medicaid, which is a healthcare for the poor, and it has some redeeming features, but some pretty significant problems. But it's been one of the ways that we we try to care for people in nursing homes, but it's a really messed up system. That system involves, as Erica said, people having to sell off assets for their eligibility for it. And that is really hard for people. It also is a system that's been in this bill, AB 1400, it spends a lot of time and discussion on saying, like, no, first we should just cover this, people. And second, that the emphasis should be more on providing services that allow people to age in place and stay in their homes, not take their home and sell it and then put them into another home and then pay that home money, a bunch of which is going for profit. It might be my connection. So anyhow, I think that when you listen and you hear kind of the problems that are out there, it's rare that you hear a problem that doesn't have something addressed in this bill, in our healthcare system. Like, there's a lot of thought that went into this bill. But Dr. Bill, maybe a good time for me. Go ahead. I see your hand up.
Thanks. Well, and I wanted to suggest to folks that there's a couple of really good movies if they're not aware. There's a movie that talks about we were talking about earlier the financial fiscal feasibility. How do you pay for it? How can we possibly afford to pay for everyone's needs, their long-term care needs, whether at home or in a skilled nursing facility, and that's what economists do, right? I mean, especially healthcare economists, they can sit down and crunch those numbers and figure that out, and they have done that. And there was a letter that was signed by over 200 economists who supported the federal Medicare fall bill as of just 2 years ago. So they've done that. But how do we wrap our heads around that kind of cost? And a lot of people think, well, all you have to do is scrap half of the military budget, the federal government. And that would pay for it right there, pay for all of the healthcare needs. Probably, you don't have to do that even. All you have to do actually is get rid of the waste, fraud, and abuse that's in our current financing, and especially if you lump in exorbitant prices for drug costs. So that's why every proposal for healthcare financing has both, has a single payer system and negotiating down drug prices, because that makes everything else affordable, including long-term care. But you can see, for example, in some of these movies, there's an excellent movie called The Healthcare Movie. If you just put in healthcare and movie into a Google search, you'll get their website. But these two delightful movie makers from Canada, Terry and Laurie, they're actually family medicine, family therapists, psychologists, and they were transitioning kind of in their career choices to making movies. And they came to the United States to make movies. And as soon as they did, they ran into healthcare issues. So they decided, let's make our first movie about contrasting Canadian versus American healthcare. So this movie is called the Healthcare Movie, and it contrasts Canadian versus American healthcare. One of the scenarios that they use in this film is hospice care, and the hospice care is, admittedly limited. Healthcare, generally the services are a lot less than, like, say, your full range of skilled nursing care, but they do have this kind of I guess a vignette of it was one of their, I think it was Laurie's mom in the film who was dying, and she was in hospice care, but it was so sweet and so kind, and so they were able to provide all of the care that she needed, and it cost them nothing, zero, not a thing. And so her father did not have to go bankrupt, and then declare bankruptcy and get, on welfare, like in this country. That usually happens, if you have your spouse or somebody, go into long-term care, then that can happen, all too easily in order to get on Medi-Cal or Medicaid in other states. It was just part of their healthcare system in Canada to provide that kind of long-term care that you might get in hospice, or even longer if it's not hospice. And it was just beautiful, and it was something that they could afford to do in Canada, because they have a single-payer system. They also had that scenario that I mentioned of the Jimmy Kimmel baby. Jimmy Kimmel came on a show and talked about his baby with congenital heart condition, needed multiple surgeries. He had a breakdown on TV saying, I'm the only one maybe, who could afford to pay for this much health care for my baby. I mean, nobody else in America could afford all these surgeries. You would have to be as rich as I am to do that. Well, in Canada, nobody pays for they get all of those surgeries, they get all of those medical procedures that you need, that kind of life-saving surgery. And the scenario there was a baby born with a heart condition, that went into cardiac arrest when it was born, had 4 surgeries over the course of 4 months. They had to fly the baby to a specialized center in another province. That was all paid for. The parents were put up in a hotel across the street for 4 months. Both mom and dad stayed in with the baby for 4 months. They didn't lose their home. They didn't lose their jobs. It was all paid for. That's what you get in a single payer system. Even, Canada is not as good, it's not as comprehensive as CalCare, what we're talking about for California. California is the 5th largest economy in the world. We actually are providing more services than what Canada provides their people. And yet they can afford to do all of that for their people. So I think it's hard for us to kind of wrap our heads around what it would actually do for everybody. And, like you said, Ron, when it comes to something like that, I'll give you another example is the Natalie Sarkeesian case, the one that, that I mentioned, that Wendell Potter, that turned him into an advocate, where he quit his job with Cigna. She was a 17-year-old girl who went into liver failure, was denied her liver transplant 7 times by Cigna, until the day she died when they finally approved it. Too late, but that's a very expensive operation. There's no doubt about it. I think the UCLA had a liver, all lined up for her to go and everything on several occasions. And then the insurance company kept denying it because it was too expensive. They had their reasons for denying it, but really it was all about the money. And it's never about the money when it's a system like, we're talking about here. Like you said, it's decided on public needs, not commercial priorities, public priorities. Sorry, bit of a rant here. But that movie is worth looking at. It's called The Healthcare Movie.
The Healthcare Movie.
Yep.
Yes, good one. I saw a question there in the chat from Paul, which was, would CalCare give small businesses a leg up?
It's from Chris Shimizu.
Oh, it's from Chris. Okay, transmitted from Chris. So Chris Shimizu, another incredibly dedicated activist, and on Facebook. Hi, Chris. Thanks for everything you do, and thanks for putting this question in. Which is, would CalCare give younger small businesses a leg up? Are large corporations so afraid of that they also oppose single payer? So first, let me answer this question or give a stab at it just from like what's in the bill, from like a green eye shade perspective of like what's in the bill this second, because the tax program still remains to be defined. How exactly it would hit a small corporation versus a large corporation is, I guess at this point, not yet clear. But I in fact think that this bill would be really good for big and small, but I actually think it would be a relative playing field leveler, because I think that on the whole, small businesses probably, at least in our current system, do struggle even more with healthcare costs in terms of the fact that they don't have as much purchasing power as a small group of people, and may also have other types of expenses that are related to scale. And so actually, the best sign of, we'll say, corporation for buying healthcare is everybody. Like one big group of people buying it for everybody is the most economical way. But as you go downward in size, it gets harder and harder. So I think that it would relatively help small businesses, and then, but still large businesses who have big healthcare costs and continue to, like, in some cases, have to make decisions about, like reducing their part that they pay for healthcare and their employees. So on the whole, even in big businesses, there's been more and more kind of pushing of costs onto employees. Like I think they'll benefit. I think California businesses will benefit. Now, whether people take the political view that that's the case, is sort of like a different matter. So sometimes you might see that the captains of industry in one industry will align their interests with the captains of industry of the healthcare industry, which may not like this stuff so much, right? I mean, I think that's a different thing. That's sort of like a political thing. It's not exactly, is this best for their business or even for their shareholders or whatever, their decision making is. So it's a set of viewpoints and a culture of cooperation among people who make a lot of money. But I see hands up from Erica and Dr. Bill. How about Erica's? What do you think?
Well, first of all, hi, Chris. Thanks for joining us on Facebook. And just want to say that Chris is a part of HCLA leadership and leads our business team. We were talking about the march earlier, and y'all should have seen Chris in her 70s get up, and she was amazing. We had, I know this is a little bit different, but Michelle Verne in our group choreographed a dance to Staying Alive. So we had this whole dance that we did throughout the march till Staying Alive, and then the refrain was, CalCare, gonna keep us alive, keep us alive. And Chris was amazing leading that dance in many areas. So hi, Chris, awesome that you're here. And then just, I know that Chris knows this, but just to share with other people, you know, people like Warren Buffett, which you could say is big business, you know, have come out publicly in support of Medicare for all. But yeah, it's a great question, Chris. I don't know very many details. I did hear somebody, and maybe Ron, you'll remember who it was, but I did hear somebody say that on some of the bigger corporations, they used their benefits as an attraction tool. A way like, so this is why you should work for us instead of another corporation. And I guess that was like, you know, one of the only differences. So there is that. So I thought that was an interesting perspective, that some may not be in support because they're using, because I guess they can pay for it and they use that as an attraction tool. But I think that far more, like when you see people like Warren Buffett, and when you look at GE, they pay more for their employees' medical insurance than they do for steel, for, you know, vehicles and stuff like that. You know, it seems to me that big business, as long as they're not in the, you know, medical industrial complex, would be for it. But really, I just wanted to raise my hand to give a shout out to Chris.
Dr. Bill, you have your hand up.
Shout out to Chris too, fellow Bernie delegate. But yeah, no, I would go a step further and say it's more of an entrapment tool, because that's the way they keep so many people in big businesses. You know, is to give them that sense that they can't leave once they're signed up with a healthcare plan. How are they going to get healthcare? And you know, in that movie that I mentioned, the healthcare movie, I know they made a sequel called Now Is the Time also, that they interviewed a couple of small business owners in Canada versus in America. And the Canadians were saying things like, you know, they were asking them, well, does healthcare come into your decision making in your business? You know, like a person who owned like a photography studio, you know, business. And she said, why would healthcare come into my decision making about my business? It's so completely foreign to them that has anything to do with their business operation. You know, once they've paid into their national system, it has nothing to do with the rest of their lives. You know, at that point, it's, let's see, do I have the time in my day to go down the clinic or not? You know, that's their decision making as regards healthcare. But I wanted to share again some of the data that drives this discussion as well. And I don't know, Chris, if you've seen this slide before, but this is, you know, economics, and this goes back a ways. So this isn't just like yesterday or some progressive think tank that did this for Bernie and for Miller, or, you know, 2 years ago or 4 years ago, or for SP 562 5 years ago by, you know, University of Massachusetts. This is an independent financial analyst group called the Lewin Group, and they did this analysis in 2004 for one of the earliest California single payer bills that was put forward by Sheila Kuehl from Santa Monica when she was in the state Senate, SB 921, that was passed by the legislature and then vetoed by Arnold Schwarzenegger. But you can see the just amazing amount of money saved per employee in small, medium, and big sized businesses in California, right? So here's under 10 employees, here's around 25 to 100, here's 500 or more employees. And you can see that small businesses save, you know, almost the most. Big businesses save the most, you know, and medium-sized businesses, they save too, although not as much money per employee. Now, obviously, these are businesses that that offer a healthcare plan for their employees. Those who that don't offer any healthcare for their employees, they're not on this graph at all. Okay, so so saying it's good for big business, well, that's true if you're a big business that offers a healthcare plan, and especially if you're a decent one. And obviously this is averaged over all of the big businesses in California, kind of thing. This is not only true for commercial business, but it's also true for public entities, public employee entities like school districts, cities, counties, the state itself. So if you're a school district with 500 or more employees, which most of them do have more than 500 employees, right? School districts are very labor intensive public employer groups. Maybe a water district doesn't have as many employees, but schools, they've got teachers, they've got support staff, custodians, a ton of employees in schools. They are saving, this is 2004, these numbers are probably double now. So, so why then is there resistance? I mean, if small businesses would save so much under the proposed financing mechanism for SB 921 back in 2004, why would big business be so resistant, even though they're likely to save so much money by going to the single payer system? And that I can tell you is 100% political. That that big business is tied in with Wall Street, big insurance, Wall Street, and big banking. And so they are 100% tied in politically with all of those major financial institutions. And they're not about to give that up, even though they would save money per employee. With the smaller businesses are the ones that are definitely more open to the idea. And you can see it benefits businesses so much, even just on a per employee basis, upwards of $2,500 to $5,000 per employee per year if we went to a single payer system, and if we did that today. Just generally speaking too, they always talk about startups, right? You've heard that concept, new business startups. New business startups usually start small and then get bigger. And that's considered to be a sign of a healthy economy. Economies that have lots of new business startups. And so when we have employees that are trapped in big business and they can't go out and innovate and start new small business, then also that's the sign of a failing economy, whether it's here in California or across the nation. So that's another more kind of general economic argument for small businesses, should be in favor. The small chamber, the local chambers of commerce should all be on board, but of course they're directed by the big US Chamber of Commerce. And once again, they're tied in with Wall Street and big banking and big insurance.
Yeah, and I mean, you mentioned startups, and so one of the things that is required to start up a new company is, in some cases, is for people to leave a situation where they have employer-sponsored insurance and go into a situation where they're creating a business and where there's no guarantee of that. But that's the idea of a bill like AB 1400, is to guarantee it for everybody, so that, as you said, with kind of your Canadian example, it takes that out of the equation, right? It takes it out of the equation to say, is this thing that I'm doing that is unrelated to healthcare going to cost me my healthcare? And probably, and I think it's the case that when a given decision is made based on sort of like ancillary considerations, right? Considerations that have nothing to do directly with the thing, that will kind of mess up that decision making in some way, right? This way to decide on kind of a healthcare expenditure is the need of that person for healthcare. And the best way to decide if you should start an ice cream business is not whether you're going to lose your health insurance leaving your job at a grocery store to start, but do you have a good idea for making ice cream and with the other, the costs and, of this and that of making ice cream and selling it and all that good stuff. So one of the things that, is the idea, I think, behind this bill is like aligning healthcare decision-making with healthcare and other life decision-making with other life issues and not with healthcare. And like, that's a really beneficial thing for a lot of people. Paul, are there questions out there on Facebook that I see some stuff in our chat, but Dr. Bill, I see your hand up go ahead.
I can, Eric had brought up a couple of things in the chat on the Zoom. I don't know, did you want me to try and?
Sure, go ahead.
Just to kind of add to what I said before. So politically speaking, it's kind of like, remember Harry Truman had a sign on his desk or something allegedly that said the buck stops here, so where does the buck stop? And like in this last, go around, people with SB 562, it kind of stopped with the Speaker of the Assembly, Anthony Rendon, and prior to that, it stopped with 6 Democrats on the Senate side who refused to vote. We only needed 2 more Democrats on the Senate side, but 6 of them abstained, so we couldn't get enough votes to get it through, the time before that. And both of those times, Jerry Brown was the governor, so you could say, well, it stopped with those 6 senators, or in the other case, it stopped with Speaker Rendon. But the fact is that the governor, Jerry Brown, if he had wanted it to come to his desk, he would have told those senators, hey, I need just 2 more of you to sign on. We've all seen the movie Lincoln, where they twisted arms to get people to sign on to the 13th Amendment, that kind of thing. So if that's something a president can do, those of us who wanted Bernie Sanders to be president, that would have been the difference, with a Bernie Sanders president instead of the Joe Biden president. That would have already have gone to the floor for a vote. Medicare for all would have already gone to the floor for a vote, I in my opinion. So that was the situation back then when we had a Democratic majority enough to pass it. When Sheila Kuehl put it forward, it went to Schwarzenegger's desk, knowing that there'd be no way he was going to sign it. So it was what they called safe, to be passed by those Democrats at the time, because they knew it wasn't going to be signed. And that way they could turn, to those Democrats who were taking the big bucks from the medical industrial complex, they could turn to those donors and say, hey, I got to vote for this, but Schwarzenegger's going to veto it anyhow. So the buck stopped, with Schwarzenegger at that time, but it was really always about the same thing, that the money that's coming in that twists the arms of these politicians. So, as usual, and I'm sure because you've had your experience with Democratic Party politics. From my point of view, of my years involved inside the Democratic Party, that the only thing that can kind of get it away from the money, to get the discussion and the movement away from the money, is more persuasion of voters and activists and advocates. And the more we can raise awareness, like this discussion we're having right now, more town halls, more movie showings, more discussion groups, raising awareness, bring the issues to the forefront, then the more likely we are to get past that influence of the money. And so where the buck doesn't stop anywhere, it goes all the way to government to get signed.
Got it. Erica, I see your hand up. Erica Farrison.
Well, so what I'm hearing is, because Sheila Kuehl had 2 bills that got to Schwarzenegger that was vetoed for 2 single payer bills. And before I ever met you all, I somehow stumbled on a meeting. It was one of my first ones. And I believe it was put on by One Payer, California. Did that exist then? Does that sound familiar to you guys? I know I'm looking at you, Dr. Bill, because you've been in this longer than all of us.
Like California One Care?
Yeah, California One Care. And I went to this meeting and they said, if we get Jerry Brown elected, we'll get this passed. And I worked so hard to get him elected just for that. And, what I'm hearing is this was just a game that those Democratic legislators who signed on to the Sheila Kuehl bills did it knowing that it would fail. And then it just feels like, so when I can ask you, Dr. Bill, but it seems like with AB 1400, even going back to SB 562, they're like, oh, well, we need the financing. We've provided that. Was that even provided with Kuehl's bill? Was any of that stuff provided with Kuehl's bill? I mean, the bar just gets higher and higher and higher for us to prove ourselves. And it's just a game. And it doesn't matter like that a Democratic governor is in place or that we have a Democratic supermajority, that it's disingenuous to be
You're
polite.
absolutely right. It is. And it's deeply, deeply cynical, unfortunately. And because Jerry Brown knew that. I mean, 10 years ago when he told Marcy Winograd, when she asked him, are you going to sign it if it comes to your desk? And he said, well, I'll sign it if we figure out how we're going to pay for it. He knew that, that was put on the desk of Arnold Schwarzenegger with a financing plan. That's what that Lewin group analysis was. It had the fiscal plan in there. That's how they came up with those numbers. They said, here's our plan. Here's what it'll do for business, small, medium, and large. You'll see business all saves money, households all save money, and yet will provide all these services that you want. That was given to them. It was given to Anthony Rendon. The day the Senate passed SB 562, that fiscal proposal from the Perry Group was given to Anthony Rendon. He said, the bill doesn't have it in it. His job is to put it in the bill. At that point, he should put it in the bill, whatever. So you're right. They absolutely do that game because Anthony Rendon, would see his job as getting funds to those people in office who can't come up with the money to fight off, the Koch brothers or the right wing or whatever they think of as the enemy. So it's a cynical game that's played in Sacramento and in Washington. But like I said, I don't think it's hopeless. I think the hope is, and I know the solution is for us to keep raising awareness, with events like we had yesterday. I know there's events coming up again this weekend because it's the anniversary of Medicare, 56th anniversary of federal Medicare. So all of those things are important. They raise awareness, and that blows the political winds towards the people away from the money. So
yeah, actually, let me mention that because and I'll share something on my screen right now. So one of the events, this is sort of related to like governors following through on what they said, because, you know, the current governor, Gavin Newsom, has said publicly that he is a single payer supporter. And it wasn't like he said that in a like quiet conversation with Marcy Winograd. He said that in a when he was running for governor, and you know, so that's different. That's a different thing. And so, and in fact, some of the so if you look at this coming, let's see, this is on the Saturday, the 31st, in two places where there are governor's offices. There is a Gavin Newsom Healthcare as a Human Right, Keep the Promise rallies. And included speaking at the Los Angeles one is Ash Kalra, the author of AB 1400, who also spoke yesterday. Also speaking in the Los Angeles one is my son Otis Birnbaum, who is so this is like also like a little bit of a shameless dad plug, but you know, and actually that happened a little bit through Otis's work with Daniel Lee, who I think you mentioned spoke yesterday, Erica, and Otis had worked on his campaign and he sort of recommended him for that. But Otis had been talking to some of the folks about, well, what is he going to talk about? Because he's a 16-year-old kid and he's like trying to decide what he wants to talk about. But part of it is that he also was at a sort of a Democratic Party thing and ran into then candidate Gavin Newsom and asked him, and Otis is a very straightforward kid, asked him, will you support, do you support single payer? And he said, of course. And he remembers that very clearly. And, you know, he's taken that as a public. And so this is part of the ongoing efforts is to, as Dr. Bill said, raise awareness and insist that people who are in office do, certainly the ones who said they've been supporters, do what they said and support it. Because if you don't do that, then of course you're saying, well, we got to wait till there's different people who are in office, and that could take a long time. So that's next weekend. So let's see, it's 13 minutes left in CalCare office hours number 18. There was a question also in the chat room from Chris Shimizu, relayed by Paul Newman. And thank you, Paul, for being just a stalwart of making sure like the mechanics of office hours and so many things work. And so thank you for that. And okay, so Chris said, Chris has a lot of interest in sort of business issues related to single payer. And she says, well, how would having single payer affect the amount of workers' compensation lawsuits? Seems like at some level, God, does that have anything to do with anything related to workers' compensation? Well, the answer is absolutely, because any kind of liability, any kind of like bill, any kind of insurance that's there to cover healthcare liabilities, right, has a part that has to pay for healthcare. And the assumption behind that part of what the insurance company would have to pay out it is that, well, not everybody has healthcare already guaranteed as a right. And if you already have, you know, like you could say, well, does my health insurance or does my auto insurance cover oxygen to breathe? Well, it turns out that oxygen has already been provided, I guess in this case, by God or nature, whatever your view is. And it's 20, you know, it's just freely available for as 21% of the air. And so that actually that insurance plan doesn't really have to deal with oxygen. And if everybody had healthcare, then already built in, then any program of liability, malpractice, or anything where damages award health care to somebody no longer has to worry about paying for that. So that does things like lower the premiums from anybody who pays premiums for those types of insurance. And so that's just another benefit. Let's see. Yeah. So as Dr. Bill said very succinctly, yeah, medical liability is included in all property insurance, including business, household, and auto. So imagine all those costs going down. Yeah, go ahead, Dr. Bill.
Yeah, those are gone. So another quaint thing that we have in America is medical liability for our businesses, household, just your homeowner's insurance policy and car insurance. You don't have that in universal healthcare countries. They don't have extra liability and insurance policies for all of those things. But really looking at workers' comp, people, it can kind of make your head explode if you look at that institution. I think it's kind of like looking at Kaiser and all the different parts of it. And, it's nice to break down workers' comp into two things. One is the medical liability part, where all employers are what they call strictly liable for the medical welfare of their employees when they're working. So it's either, injury or illness as a result of their working. Okay. Now that means there's a medical part where they're liable for your medical care. Guess what happens with that when you have universal health care? It's gone. You no longer have to worry about, employers don't have to worry about it, and employees don't have to worry about it. That's already given. Everybody already has health care. The other part of workers' comp is the legal part, where an employer can be legally responsible for issues that result from your working there. Some of that is health and safety requirements like OSHA, the Occupational Safe and Safety and Healthy, or whatever that stands for, administration. So some of those are already, kind of legal entities that, by statute, but others of it is just legal. So, every employee should have the right to hold their employer responsible for things that happen to them at the work site, if it is, something that the employer has within their ability to control. That's a legal decision, that where you could take your employer to court kind of thing. So that part of workers' comp should exist. But the healthcare part, where the employer has to provide a healthcare for you, that would be gone. So, every cup of coffee you buy at Starbucks has workers' comp charges in that. You're paying for it when you go to Starbucks. You're paying for that medical liability of workers' comp. You're also paying for the medical liability of standing inside of there if anything happened, if you slipped on a wet floor, right? That's not workers' comp. That's just property insurance for a business, which wouldn't be necessary either. You're no longer having to pay, as a business, having to pay for their medical bills if somebody gets injured on the site. And that's true for employees as well, which is that part of workers' comp. That just disappears altogether. That's incredibly favorable for businesses. And again, why even big business should be 100% on board if we could ever separate them from big banking and Wall Street, and which again, we can only do if we keep raising awareness and keep pushing.
No, beautifully said, and it made me think about Chris's question, your description, your better answer, by the way, made me think about whether, if you get into the weeds of costs to businesses, if any of the studies have also taken into account reduction in premium costs for not directly for health insurance, but for built into all their liability things. Like, has that savings been baked into some of these calculations? Because if not, they certainly should be. But do you have any visibility on any of that?
Yes. Answer is yes.
Okay.
That's what economists do. They factor in all of those savings. So that's part of what makes it so much less, expensive. The savings, I mean, those kind of repercussions of savings go on and on and on, with systems like this. I mean, it is putting us at such an economic competitive disadvantage, for California. I mean, if we're now the 5th largest economy in the world, if we went to a single payer system, what do you think? 1st largest economy? 2nd? 3rd? 4th? 3rd largest, at least.
Well, so, and that's, I mean, when you go back to that, the spaghetti image, which it's hard to show, you can't really show that too often. I mean, it's so fantastic, but you think about every line in that, there's somebody who doesn't do healthcare stuff. So every line in there, maybe not every line, but lots of lines in there, there's somebody who isn't really involved in actually like healthcare or kind of, helping people with health problems or preventing health problems, who's also potentially just like skimming some money off of the money that flows through that line, right? And I mean, the companies that sell like other insurance, I'm sure, I'm not talking about healthcare insurance. They've got all kinds of clever people, and I'm sure that, if some of their lines of business were less, there was smaller throughput, they'd find other productive uses for their time and energy and interest. But those things cost money. And so I think it's sometimes they may in fact become like hidden costs, right? Like it's almost like they're like negative economic multipliers on the economy. I think there are sort of more drags than we imagine from our healthcare system on our economics. And you can identify some of them, but I think there's all kinds of ones that would just, the simplification just eliminates
and the end
a
result,
bunch of loss. Yeah.
And the end result is this, right?
Exactly. Yeah, absolutely. In other words,
That's
like, well, why? Yeah, and it's not the case that everything in the United States is more expensive than it is in Canada. There's plenty of things that are more expensive in Canada. Healthcare stands out for weirdness, for its priciness in the United States. So, and what's the difference? It's the system. So, we are 3 minutes from done, and so I do want to kind of start to wind us down and draw us down, but just see if anybody else had any parting thoughts or anything that they wanted to, any thoughts for like, maybe like going forward or anything like that. Certainly most people here who are in the Zoom know how to reach us, or if you're on Healthcare for All Los Angeles following the Facebook feed, put some comments there, things you'd like to hear more about at future meetings, and we're just going to keep doing them and keep trying to bring people into these conversations. So, Erica, do you want to dot the I or cross the T on number 18?
Just, there's that event coming up, just everywhere you can. You guys, we have a bill, AB 1400, shout it loud, shout it proud. This bill is an amazing bill. You've heard about how amazing it is from all of these CalCare office hours. It is the creme de la creme. 5 months we have to educate everybody. AB 1400 CalCare now.
Fantastic point. And so let's end that like a salute to AB 1400, to not single payer Medicare for all as an abstraction, but to CalCare, to the CalCare plan and the effort that it's taken to get it in front of the legislature, and honoring the people who made that effort, and to the legislators who've taken risks and doing work and are like showing up at rallies and things like that. Also showing up at rallies where people criticize them, right? And still showing up anyhow. So hats off to anybody out there who has stood up for this bill, for AB 1400, and taken some heat for doing it. You know, thank you. Like we appreciate you, and we're going to keep fighting with you. So
Alongside.
let us. Yeah,
We're going to
what's
fight
that?
alongside you.
We will fight alongside with you. Yes, we will not watch you walk the plank by yourself. We will fight with you. So, all right, and we'll see you next Sunday. Thank you, everybody.
Thank you, Ron.
Thank you, Ron.
Oh, yeah, no, thank you, everybody here.
Thanks, Paul.
Thank you.
Thanks, Erica.
Erica.